So both oral contraceptives and hormone replacement therapy consists of estradiol plus minus progesterone. So what is the difference between them, and what is the risks between the two? So first, the risk of venous thromboembolic disease is higher the higher the estradiol and the progesterone level is. And oral contraceptives, as a rule, have a much higher dose and a high concentration of both estradiol and progesterone compared to what we use in the peri- and postmenopausal period. The reason for this is that we are trying to suppress the pituitary centrally so as to decrease or minimize the risk of ovulation and therefore the chances of getting pregnant. And certainly in the menopausal time period, we don't need those high doses because the woman is not ovulating. If someone is in the perimenopause, we sometimes might still require this pregnancy preventative effect, and therefore we might continue for 1 or 2 years after the onset of menopausal symptoms with drugs such as the combined oral contraceptives. But know that the risk of thromboembolic disease is certainly a little bit higher. We also sometimes use the ratio in the combined oral contraceptives to decrease the symptoms of PMS so that you don't get that significant drop in estrogen and progesterone, because in the postmenopausal time period, you actually don't need that. So again, a decrease in exposure to estrogen and progesterone. Third, estrogen, when it passes through the liver, actually increases a molecule or a protein that we call sex hormone binding globulin. So the function of sex hormone binding globulin in the human body is to bind testosterone. So when we give a lot of estrogen, sex hormone binding globulin goes up, the testosterone binds to the sex hormone binding globulin, and you've got a reduction in the amount of free androgen. So sometimes this is not something that you actually want in the perimenopause when you desire more of an androgenic milieu for the symptoms, whatever that might be in the specific woman. So a lot of reasons to transition from combined oral contraceptives to hormone replacement therapy to reduce not only the risk of venous thromboembolic disease, but also with the newer progestogens that we can use as peri- or postmenopausal hormonal replacement therapy, we decrease the risk, in fact, of things like breast cancer and strokes. So you can't stay on your oral contraceptive from the menopause onset until when we would stop it. There certainly needs to be a reduction in dose unless contraception is required during the perimenopausal time period.